Hello, and welcome back to the Take10 Podcast. I am excited to be here with you today. I hope that whatever you're doing and wherever you're at, you're having a great day. Last week, we dove into the topic about trauma and the impact that trauma has on one's mental health, both in body and in mind, and some ways that individuals can receive care to deal with their trauma. We're cruising along in 2025 so far. As we've mentioned before, really this first quarter of 2025 is exploring all things topic related to the foundations of mental health and well-being. We've talked about what mental health and well-being are, better understanding depression. We've had a guest, Stephanie Eiler, talking about anxiety disorders, the connection between physical and mental health. We've talked about self-care. Again, we talked about trauma last week, and we've talked about some support systems. So we've had a lot of really great topics. And as we start preparing for the next quarter, we're really going to dive into some additional information around treatments and the therapies that are available for mental health. So I hope that you're excited about that. I hope that you're ready for that, because I know that I am ready to learn more about some of the therapies that are available. But we still have a few things that we've got to cover in order to build our foundation of understanding in mental health and mental well-being, and we're going to continue that journey today. So this is the show where we explore mental health, mental well-being, and all of the ways that we can go ahead and take care of our minds. So for those that are new, or for those that may need a reminder, my name is Ryan, and so excited to be guiding some of this discussion today. Because today we're talking about a really important conversation. I think that we could probably argue that each of these topics are important, and I would agree with that. But this one holds a special place in my heart, because I think what we're about to talk about prevents a lot of people from getting the care that they need. And today we're talking about breaking down the stigma that surrounds mental health. All right, so let us go ahead and jump in here. Mental health stigma affects millions of people worldwide. The stigma around mental health keeps people from seeking help. It reinforces harmful stereotypes, and stigma about one's mental health can contribute to an individual's feelings of shame and isolation. And so what I want to talk about is, why does this stigma exist? And then what are some things that we can do where we can challenge that stigma? So before we dive into some of those questions, though, let me ask you a question, and you can feel free to answer it to anybody you're listening with, or just to yourself. But have you ever hesitated to talk about your mental health because you feared that you might be judged? And it's okay if you need to kind of search your soul for that question. But if you have, you're not alone. If you've felt like you might be judged for talking about your mental health, you are not alone. And actually, studies show that about 90% of people that have a mental health condition feel some stigma and discrimination associated with that, and that it negatively impacts their lives. That was due to a recent survey in 2023 from Mental Health Foundation. So today, we'll break down what that stigma is, how it affects us, and then most importantly, what we can do to change the conversation around mental health. So first of all, let's talk about what stigma actually is. And stigma, when you boil it down, is a set of negative beliefs, or it could be attitudes as well, that people have about something, which is often based on fear, misinformation, or even cultural norms. And when it comes to mental health, um, stigma can actually take multiple forms. And this is something that was a little bit new to me. And I probably should have known there were different types of stigmas out there, but I thought this was interesting. The three main types of stigma are, number one being social stigma. And a social stigma is the public perception of mental health. It could include harmful stereotypes like assuming people that have depression are just quote unquote lazy, or thinking that anxiety is just a person that worries too much. The other stigma is called self stigma. And this happens when individuals internalize these negative beliefs, um, and believe that they may apply to them. When that happens, they can feel ashamed, or they believe that they are weak for needing help. And then lastly, the third form of stigma is structural stigma. This this includes policies and systems that discriminate against those with mental health conditions, such as any insurance gaps that exist for mental health treatment, or in workplace discrimination. One of the most prominent examples of stigma is the belief that mental illness is a sign of weakness. Um, but I also want to make sure that we set the record straight early on, and that is that mental health conditions are medical conditions, just like those other physical medical conditions like diabetes, heart disease, getting the flu. Those are the exact same as those individuals that have a mental health condition. And actually, studies do show that mental illnesses have biological, genetic, and environmental causes as well. But even though we've done studies, there have been some studies done that have been completed by the American Psychiatric Association, that showed that these mental illnesses are stemming from biological or environmental causes, but yet we still have this stigma around mental health. And a study in not too long ago, we're talking 2022, this study showed that despite increased awareness, there were still negative attitudes toward mental illness that are out there. And this is especially prevalent in workplaces and healthcare settings. And I'm always led to this question of why. Why would that be the case? And I think because for decades, we haven't been willing to discuss mental health openly. Instead, we've chosen to keep these conversations hidden, which leads to misunderstanding. And the topic of mental health has been, I think we're making some changes, but it has been mocked in the media and in society. I think mental health has been misrepresented and further stigmatized, especially in the media, in several ways. First, there's a stereotypical and harmful portrayal of mental health in movies and in TV shows. Oftentimes there may be characters that have a mental illness that are frequently shown as dangerous or unpredictable, or even violent, even though studies have been performed that show people that have a mental illness are far more likely to be victims of violence than the perpetrator. Um, Examples of this might be in horror films. They often depict characters with conditions like schizophrenia, sorry, as being these murderous villains, right? We think about the Joker or the movie Psycho. Um, Comedy shows and sitcoms have also used mental health as a punchline for jokes, which, when this happens, it just reinforces the stigma. I don't want to have the masses come at me in response to this example, but in the show Friends, there are jokes about therapy, and there are jokes about Chandler's father's gender identity, which make light of potentially very significant emotional struggles. Second, it's something called the crazy trope. Terms like crazy or psycho, and even nuts are thrown around carelessly in media, which, when this happens, it reinforces the idea that mental illness is something that is okay to be ridiculed, rather than allowing us to better understand it. So when I think about some examples of how this happens in the media, in cartoons and in children's media, there's characters with erratic behavior that are often portrayed as being needed to be locked away, right? We think about the Arkham Asylum in Batman. But it's not just to TV shows or cartoons and in kid shows, but like talk shows and public ridicule often occur as well. So sometimes we have celebrities that are struggling with a mental health issue, and rather than having conversations about what they may be going through and how they might be able to get help, we mock them in the media instead of supporting them. So we think about Britney Spears, especially in 2000, I think it was like 6, 7, 8. She had a breakdown that was sensationalized by tabloids instead of being seen as maybe a sign that she needed help. And so, unfortunately, memes and viral content often make fun of people in crisis instead of promoting awareness. And so when this happens, stigma is going to persist. There's also just a myth of the individual needs to get over it. So we have examples of TV shows and movies that push this false narrative that mental illness is just a personal weakness that, can be overcome with willpower. Yeah, I don't watch these shows, but so I had to do some Googling of where this may persist. But in some reality shows like The Biggest Loser or America's Next Top Model, some of the mental health struggles supposedly are dismissed as excuses rather than legitimate concerns. So, and then the last one that I'll mention is in the media, we lack there's a lack of representation in a realistic light of what mental health is like. Again, I think that there is some progress being made, but while while progress has been made, I think realistic portrayals of therapy, medication, and everyday struggles are still rare. And some good examples of that positive change that is shown in the media are from shows like This Is Us and Euphoria. They've done a nice job of portraying mental health in a nuanced way, and so I think we need to do a better job of portraying it in the media as one way to help overcome that stigma. But the impact of stigma is huge, because stigma prevents people from getting help. And there have been some studies that show that almost 60% of people with a mental health condition don't receive treatment due to a stigma or fear of being judged by having mental illness. And that was a study as recent as 2022. done by the National Institute of Mental Health. So that's pretty recent, that 60% of people are still feeling like they can't get treatment due to a stigma or a fear of people judging them because they might have a mental illness. And second, stigma not only prevents you from seeking help, but it also can affect your self-esteem. When people are constantly told that their struggles are just in their head, or that they need to toughen up and get over it, and you know, uh, buckle up, or whatever they may be told, it leads to feelings of shame, and they feel isolated. And having some self stigma can be just as damaging as the external stigma that may be affecting an individual. And it can also have some serious consequences too, right? So when we feel like there's a stigma associated with us having a maybe a mental health condition, it could lead to delays in treatment, which can lead to worsening symptoms. And then you could see how delaying treatment, because you feel like there's a stigma associated with that, so you get worse symptoms, and now you're even more worried that you have even worse symptoms and you might be judged more, so you're not going to get care there, and it becomes this vicious tornado almost. When people don't seek treatment because of a stigma, there could also potentially be higher suicide rates. According to the World Health Organization, suicide is the fourth leading cause of death among young adults worldwide. And so people that don't get the help that they need feel like there's no way out. Excuse me. Stigma can also affect the potential workplace. So there could be discrimination in the workplace. Again, in 2021, a study in Psychological Magazine, or Psychological Medicine magazine, found that people with mental health conditions were less likely to be hired or promoted due to the stigma. But the reality is, stigma doesn't just hurt individuals, it hurts our society as well. Like we've talked about, it creates barriers to care, which contributes to poor mental health outcomes, and it just further reinforces these cycles of potential discrimination and people that are suffering. So the question that I hope is coming up is how we can reduce stigma and advocate for mental health. So I want to talk about some ways that we can reduce that stigma. First, I think we all need to be better educated and aware of mental health conditions. Knowledge is power. The more we educate ourselves, and as we become educated, the more we educate others, the more we can dispel myths around mental health. Education-based interventions can significantly reduce stigma and increase empathy. And education-based intervention is a strategy that was designed to reduce stigma, increase awareness of mental health, and to improve understanding of mental health issues through a structured learning process. And these education-based interventions aim to correct misconceptions that we might have, to challenge stereotypes, and to promote more supportive attitudes towards mental health conditions. And so here's how a education-based intervention works. Typically, they're going to involve something like this. First, they're going to provide factual information, educating people on the biological, psychological, and social aspects of mental health conditions. Two, they're going to debunk myths and stereotypes associated with mental health. They're going to address common misconceptions like people with depression are just lazy, or mental illness is a choice. They're going to use personal stories. Research has shown that hearing firsthand experiences from individuals that have or have overcome a mental health condition reduces stigma. And then in these education-based interventions, they're going to then encourage open discussions. When we are able to create safe space for conversations about mental health, we can overcome misconceptions and better understand what's actually happening so that we can reduce some of those misconceptions and stigma. So what does an education-based intervention even look like? Well, they have a few um, there are a few ways that this could look. First, it could be a school program. Mental health education in schools helps to teach students about emotional well-being, stress management, and recognizing symptoms. There could also be workplace training, um, mental health awareness workshops that help employees recognize signs of distress and the ability to learn how they can support colleagues. And then there are public awareness campaigns. In the United Kingdom, there's something called campaigns like Time to Change, and in Scotland, something called See Me, and these aim to reduce stigma by sharing real stories. And then here, there are a lot of organizations that provide a really great amount of material so that people can further educate themselves. The National Alliance of NAMI, mental illness. And then there's also the American Foundation for Suicide Prevention. And actually, just this week, as we talk about public awareness campaigns, my parents had the opportunity to present a presentation that was put out by the American Foundation for Suicide Prevention, where they're talking about all of these topics, talking about overcoming the myths, talking about what drives potential mental health conditions, asking or creating a space so people can ask questions. And, there were maybe 80 to 100 people there, 90 minutes. And my parents were able to help people learn more about mental health. And so it's things like that are going to make our ability to reduce stigma an actuality. And then lastly, you may see but in media and social media initiatives where they're trying to help people learn more. There are documentaries, there are podcasts, there are social media movements. There's a hashtag out on social media, End the Stigma, for example, that are aiming to educate people on mental health topics. So, how effective are these interventions? And actually, studies show that education-based interventions significantly reduce stigma, and they actually increase people seeking help. There was a study in 2021 in the Journal of Mental Health that found that participants who received some mental health education had a 40% reduction in negative attitudes towards people with mental illness compared to those who didn't. So that's pretty significant. As we work to end the stigma, I think it's also important that we recognize that the language we use matters. The words that we use really shape our perceptions. And so rather than saying things like, oh, that person is so bipolar, say they have bipolar disorder. Things like this, like a small change, reinforces that mental illness is a condition and not an identity. You would want to be known as Joe or Sally, not, hey, you are bipolar. You're John and you have bipolar disorder. Your mental illness, mental health condition doesn't define you. It's also important that we use or avoid using phrases like they're crazy or they're insane. And so be mindful about the words that you use because they do matter. Third, To help end stigma, we need to encourage open conversations. Because when we talk openly about mental health, we continue to normalize it. There have been a number of celebrities that have recently come out. Simone Biles, Prince Harry, The Rock have all spoken publicly about their mental health struggles, which further helps to break down stigma on a large scale. And then fourth, we need to lead by example. Not to say that you have to share your own experience as you've worked through a mental health condition or worked on your mental well-being, but if you feel comfortable, it's important to have those conversations with others. Hearing personal stories of mental health struggles can lead to a reduction in stigma-related attitudes among people. And so when we hear of others that have gone through something or are going through something, and especially if they're people that we know, that can really go towards reducing that overall stigma. And then lastly, we need to affect policy and community support. So as individuals, we can advocate for mental health policies in both the workplace and in schools, support mental health organizations and initiatives that push for change within the system. And this could be a variety of different things, but just as an example of things that I have noticed, the group, the American Foundation for Suicide Prevention, has an advocacy challenge where you can write in or go to the Capitol and petition your local leaders for policies and updates, which can really make a huge impact. And it's as we do these things that from a large scale we can work to reduce overall stigma. So this week, if you feel comfortable, I've got a challenge for you. And maybe it's having an open conversation about mental health with somebody. If it comes up, or if you feel comfortable sharing that with somebody, it could be a friend, it could be a family member, it could even be on social media. I think it's important that we begin talking about this. Not something that you have to do, but if you feel comfortable, that's awesome. Maybe you share a fact. 1 in 4 people at some point in their life are going to, experience a mental health issue, or maybe it's sharing a personal experience, or it could be as simple as checking in on somebody and just saying, "Hey, I've been thinking about you. Hope you're okay. I'm here if you need anything." Legitimately, that's all you have to do. If you're up for it, I'd love to hear from you. Tell me, what's one way that you've challenged the mental health stigma? I'd be curious to hear what your thoughts are and some of the steps that you're taking to help with that. Before we end today, let's recap real quick some key takeaways that I had from today's episode. First, mental health stigma comes in different forms. It's social stigma, self-stigma, and structural stigma. Stigma about mental health can have some serious consequences, from preventing treatment to increasing the risk of potential suicide. But it's important to remember that we can break the cycle. We can do it through education, through changing our language, and having open conversations. As we do this, we're going to make positive change. And I know that not in the too distant future, we're going to think about mental health and mental illness in a much different light than we did even just a few years ago. I appreciate you being here today. I appreciate you listening. Again, I say this all the time, but it's because of listeners like you that we are going to affect change. And it, again, is not something that's going to happen overnight. It's not going to be potentially easy, but it's also through small and simple things that you're going to be able to make that large change ultimately. And it's having a conversation with somebody today. How are you? How are you feeling? Is there anything that I can do for you? It's maybe signing a petition about increasing, or reducing the gaps of mental health care and insurance, for example. And maybe it's doing something good for somebody that may be struggling a little bit, whether we know it or not. It's really those instances where we look to do good in somebody's life. It's the power of doing, being, and inspiring good in all that you do. And when we do that, ultimately we're going to succeed, and we're going to make the changes that we want to see in this world. You've got it. We've got it. Thank you for being here. I appreciate you. I hope you have a great day. We'll see you next time. All right. Goodbye.